Hey, welcome back to the Zephyr Wellness YouTube channel. My name is Jake, and it's been a few months since I did one of these videos, and I'm really excited to be back doing it again. I took some time off to do some stuff around the business and launched a podcast called Noggin Notes. I recommend you check that out. It's associated with the app called Noggin Notes. And the app goes on the phone or a tablet, and it's a great way to be able to track your thoughts, feelings, moods, and life events. You can look it back up on a timeline later on, and it's a great digital diary, basically. You don't have to do the hard copy version that people can snoop through or pick up and steal, or you can lose on the bus. So I recommend checking out Noggin Notes. It's free, and I'm glad to be a part of that. Some really great guys who put that together. And I also had a birth of my second son. So now I have two boys, and that was also part of the time off. But I'm glad to be back and doing this. It's fall now in Reno, Nevada. And today I wanted to talk to you about the difference between symptoms and problems. Couldn't think there for a second. I apologize. I was trying to untangle my microphone cord. But the difference between symptoms and problems, as we conceptualize it at Zephyr Wellness, and I know I can't speak for every clinician on the planet about this, and it may be a little controversial to hear it come out of my mouth, but I view symptomatology as the presenting outward behaviors that come before a crowd or an audience. So for example, a symptom that I don't like to deal with may be drinking too much. Now we can diagnose that as an alcohol use disorder. Similarly, we can deal with the symptom of anxiety as an anxiety disorder, or depression as a depressive disorder, or mania followed by depression as a bipolar disorder. But in my view, I'm not a big fan of treating symptoms, and I view those as symptoms because the problem is usually something deeper. I'm big into problem resolution. I think human beings are just simply deeper than their outward behaviors. Outward behaviors could be me sitting in this chair, moving my hands the way that I am, or fiddling with the microphone cord that was stuck. But they can also be anxiety, depression, eating disorders, mood disorders, alcohol use disorders, substance use disorders, any sort of disorder you can think of. Anything that interferes with life could be a symptom. The reason I break it off that way is because if we treat symptoms, what we end up doing is we end up playing a little bit of therapeutic whack-a-mole. And if you've ever played the game where the moles pop up and you whack them with the hammer and they fall back down, and then another one pops up and you whack that one, and another one pops up and you whack that one, you never really get to the end of the game. It's all about scoring points and so forth, but how do you stop the moles from popping up? Unplug the machine. That's the problem. The problem is you put a quarter in and it has power. If it doesn't have any power, no moles pop up and you're not sitting there whacking them in order. I view psychological symptomatology the same way. I'm not interested in helping cure somebody's alcoholism only to have depression pop up in its place because the problem that created the alcohol use didn't feel good about oneself, doesn't know where they're going in life, relational problems with a spouse, child problems, something that's not diagnosable with a code that I cannot send up to insurance to make sure that I get reimbursed for it. It's something deeper than that. And I'd rather look to the depth of a human being and help them solve whatever that problem is, and then the symptoms just go away. I don't have to sit there and keep chasing symptoms around. So my invitation to you as you're watching this video, and maybe this is rocking your world a little bit, I've been doing this long enough to know that some people are going to hear this and go, wait a minute, you're telling me my alcoholism isn't a problem? That's not what I'm saying. I'm not saying it's not problematic. I'm saying that there's a difference between treating the issue that's creating the other issue versus just dealing with surface level stuff that can then pop up in a different form elsewhere. So my invitation to you as you're listening to this is evaluate what may be going right or wrong in your life and assess it when you go into psychotherapy or counseling in context of whether this is a symptom or a problem. Medically, we can treat symptoms, and we absolutely want to treat symptoms so that life function can happen. If a person's symptoms are too great that it's interfering with life itself, and certainly if it's interfering with talk therapy, we certainly want to treat those symptoms. We treat them with medication, we treat them with behavioral change, we treat them with coping skills, we treat them with diaries and journaling, we treat them with meditation, all sorts of treatment. but it doesn't necessarily get at the root of the problem. So what I encourage my clients to do is notice the difference, and then instead of attacking the surface level symptomatology, we go deeper into the problem, and that's where real effective change tends to happen. My experience tells me that when we hit the root, the leaves just die. And isn't that really what everybody wants? We want our problems to go away, but instead of labeling them as the problem, let's start calling them symptoms and see what the real problem is. For me, for my money, most of it has to do with emotional intimacy. I've done a ton of podcasts on emotions and emotional functioning, and even a couple of videos. You can certainly look those up. But for now, just take this and see what you do with it. See how it hits you. If it lands on you awkwardly, that's probably fine. I'm not attached to this theory. I know it's not for everybody, but it seems to work for a lot of folks. So, as always, on behalf of Zephyr Wellness, I thank you for listening. It's always an honor to get feedback from people, because it's humbling that people listen to what I have to say. And I wish you great mental health, and please check out the app called Noggin Notes. Take care.